Shalom and welcome to Jerusalem Studio. The crisis that emerged in Israel with the eruption of the coronavirus has mesmerized the local population to an extent unprecedented, short of an all-out military conflagration. In contrast to other Western societies, where the number of fatalities is much larger, the Jewish state is also dealing with a political deadlock in Jerusalem and is in a unique position of having to contend with two major crises at once. To discuss this complex situation, we're joined here in the studio by Dr. Lerman, who is the Vice President of the Jerusalem Institute for Strategy and Security and a lecturer at the Shalem College. Welcome. I'd like also to welcome our TV7 analyst, Mr. Amir Oren, as well as Professor Zeev Khanin, who is an expert on Russian and Middle Eastern studies at Ilan and Ariel universities. Welcome.
Pleasure.
I'd like also to welcome Dr. Fadi Essmaeel, who is a research fellow at the Institute for Counterterrorism at Herzliyah. Welcome. Mr. Oren, give us a broader understanding on the latest developments pertaining to this crisis, which is global, of course, but impacts Israel not less than any other place, as well as the other challenges that have been overshadowed by this COVID-19 epidemic.
Medical practitioners, of which our friend Fadi Essmaeel is one, say that the most vulnerable people during this crisis are those who have other ailments to begin with. And therefore, when they are struck by the virus, they tend to be a much more harder case to cure. And similarly, Israel has entered this crisis with several ailments, political ones and some security challenges. So in contrast with other countries which have to deal with this crisis, admittedly, and with its economic and social repercussions, but are free from political and security challenges, Israel, first and foremost, has yet to solve its political problem following the third elections in less than a year. It is now in the process of sorting through what has happened in its parliament, the Knesset, and later forming a government. And as it is doing that, it has to contend with more than 500,000 unemployed, an unprecedented amount of people, or at least for the last 65 years, it has not been marked, and with devastated businesses and households, which the new government will have to take care of. And all the while, its health ministry has to find a way to get treatment in time to the growing number of coronavirus cases.
Dr. Lerman, a little over a week ago, on Thursday to be precise, the IDF proclaimed state of emergency, the highest level, which is preparedness for war, and shortly thereafter, the government or the interim government under incumbent Prime Minister Netanyahu declared general closure on Israel, which has been only partially enforced with all kind of leniencies to the public. But at the same time, we see quite the drastic closures, measures undertaken in order to secure Israel from the outside, in order to deal with domestic issues, which seems to be, even though the Jerusalem government is trying to do everything in its power to thwart this contagion from spreading further, the numbers are rising as they are in the rest of the world. How can you identify right now the current process, which is seemingly not really working with regard to thwarting the contagion from spreading even further? Of course, giving some credit to the government for all the measures that it's undertaking, it has limited the contagion from getting out of hand, which is at least from what we see on the sidelines.
Well, basically, the argument put forward by the government is we could never, ever had any chance of preventing this from spreading. It's in the nature of such a contagion that it will continue to spread and the numbers will rise. However, we need to bring the situation under control, and they call it flattening the curve, so that the hospital system, essentially the capacity of the public hospital system to treat incoming patients will not collapse. What we have seen in countries where the spread has been very dramatic, uncontrolled, where measures were taken too late, like northern Italy, like possibly what we're seeing in Spain. Some people speculate that this may yet strike in Britain, but we don't know because there too measures were taken quite late. What we are seeing in Israel right now is that time has been gained to create the necessary infrastructure for response, both in terms of testing and in terms of hospitalizing the most acute cases, so that we don't get to the point that has been tragically reached in parts of the Italian hospital system where people practice triage, where people are saying, you know, if you're over 70 and you're likely to die anyway, we're not going to put you on oxygen because there's no point. We need that for those we can save. Like, you know, we all know that this happens in a battlefield, but that this should happen under peacetime conditions.
Indeed.
In Bergamo is the one thing that Israel has to avoid. And so far, I have to say that so far the measures have definitely prevented the collapse of the system. The military alert is very much in response to the possibility that the IDF would be needed internally to carry out certain missions, not so much enforcement, that's the police, but for example, if we get to a full lockdown, because we're not, you can call it a breathing lockdown, there may be a need to carry logistical operations, to just get things from one place to the other. Because interestingly, I think it's a delusion, but for the time being, the external threats seem to have died down. Hamas is not sending incendiary balloons, except for one incident. There's been very little friction with the Palestinians. Iran is absorbed by the catastrophic situation there. So there's a time for the IDF, a breathing time for the IDF to be of help on other missions.
Indeed. Dr. Essmaeel, I would like to follow up on a question pertaining to Israel's medical capabilities to withstand this situation. For years prior to the crisis of this contagion, the health authorities in Israel have been repeatedly and unrelenting urging the government in Jerusalem to enact certain measures in order to prepare ahead of potential crisis. As we're seeing today, they've been talking for years and years and years about a lack of hospital beds, a lack of basic tools that are needed to safeguard the health staff operating in the hospitals. Where is the government now in being able, at such a time of global shortages, to actually fulfill the requests and demands that now are vital in order to continue dealing with this specific situation?
Look, I always like to be fair, but honest, which is two properties that make you really unpopular among politicians and bureaucrats. You are correct. There are, for years, not only in Israel, but I have a perspective on other Western countries, where as long as the health system is not collapsing, nobody really pays that much of attention. And what happens, I'm speaking as an emergency management specialist, emergency situations have this quality to them that once the routine mechanisms are overwhelmed, you get into a decompensation mode, into insufficiency, all of a sudden the breakpoints of the systems show up. And some of them are really ridiculous. Really, swabs? We're short on swabs? I mean, this is, People talk about complexity theory and chaos theory and all these big regression analyses, all that nonsense. Yeah, it's important to know these things, and I teach it. But frankly, in the end, it goes down to a swab. And we fall on those ridiculous bottlenecks. And the question is, why are we there? Now, it is not only about beds and equipment and all of this stuff, and testing kits and all of that. It is about personnel. And I can buy you ventilators. In Italy now, they are printing, 3D printing ventilators. Mm-hmm. Are we ready for that? Now here, do we have the printers?
It's being done here.
Hopefully. And I have a friend from California who talks about using CPAP and BiPAP machines to do something with them to make them water. And it has already been done in Massachusetts and other places. People become creative. And the question, where is all of that creative energy? Why isn't the system, and it's not the health system. It's not the health system because now we're outside the boundaries of the health system. This is how emergencies happen. They start spilling into other areas of life. Now it's a national issue, international issue. So why aren't we during the routine times have those that way of thinking, creating all this fat that we need, for those times. Especially Israel, with such a small country, with such non-existent, really, and we have no ability, no place, no safe place. We don't have the safety margins, should I say that, in any area really. So why don't we do this in real time? And frankly, I don't want to be unfair. I know that people inside the system work very hard. This is beyond the health system. Mm-hmm. And we have to be fair. Now, I have to say now, for full disclosure, I'm in the middle right now of research for academic purposes with a team of 3 or others, when we are basically researching in real time, Israel's government response to Corona vis-a-vis the standards, okay, as they appear in the books, in the literature, and we have very, very rich literature about crisis management, about emergency management, about public health crisis management. It exists, it's there. And we're basically building the timeline, and we're watching what should have been done, or the range of what should have done, and what actually happened on the ground. And the idea is not to get people upset or anything like that. The idea is really to put fact-based, fair, evidence-driven analysis, and hopefully we can get into the minds of people that this is not like the horse. The health system is not like the horse that you can train not to eat every time you just take a few grams off the diet, and in the end it can live forever. Mm-hmm. And I'll give you the last example that really touches me in person. The main issue is personnel. I can get you all the beds in the world. I can put all the, I get you the space. If you don't have the personnel, it's meaningless. Let's speak about doctors. Why is it so hard for the state of Israel to license physicians? It is so hard. We have in the whole, the system that actually licenses medical doctors, there's actually a guy and a person who takes care of that. That's all. I can tell you, I'm an Israeli. I studied medicine in Israel. I practiced medicine in Israel. I left the country for several years. And naturally, when I came back, it was my own experience. And when I came back here, naturally, they have to take you through a few months just to make sure that you still know what you're doing. That's fine. To start that process took me 20 months. And I'm a graduate of the best medical school in Israel. And I'm seeing what happens to when I was working in a hospital, I've seen what happens with the young guys that come from other countries. We have more than 1,000 physicians ready to go right now, this minute. And we're driving me nuts just to get them the licensure. And it's okay, you can put them as interns. We've all been interns. Mm-hmm. And they can work under supervision, and you know how helpful that is? I'm only speaking medical doctors. I'm not talking about the other professions. And as it is in other systems that we have in government, somebody needs to really do, I'm not talking about another committee investigation, a real overhaul is necessary.
Professor Khanin, I'd like to hear your take on the government's response to the situation. Of course, with a lacking permanent government in Jerusalem, if you will, considering the ongoing bickering on the political level between the various parties and political blocs, to what degree do you see the ability to actually enact measures that would provide the necessary tools in order to treat not only this crisis, but at the same time also manage the other crisis pertaining to ongoing challenges from Iran or from Syria or from Lebanon and elsewhere. To what degree do you think that the current government in Jerusalem is able to deal with this at the helm? Of course, not taking away the abilities of the operational bodies, whether it's the military, the police, and so on, to execute their tasks responsibly.
Let me just continue to what Dr. Lerman said when he spoke about sustainability of the State of Israel. Normally, we all teach that it includes four major aspects: good diplomacy, military strength, and of course military industry, which is able to provide necessary infrastructure and resources for this strength. The third thing is actually, which is probably most important in this situation, is actually the public trust of the government. So in case, which means this is also a part of what we call the collective solidarity, meaning that quite important that the Israeli public believes that the government is doing right thing, and in spite of the rest shortcomings here and there, at the end of the day, we will get good results. Let me, for a second, come to another field of my expertise, which is the sociology of Aliyah and integration, meaning immigration to Jews of Israel and integration in the society, and come back to the beginning of 1990s, when immediately 500,000 people came here. Among them were 25,000 physicians and other medical employers. And more than 100,000 engineers. So it was not an easy time. However, the government made right decisions. And these 25,000 doctors, nurses, and other medical employers postponed for 20 years a need to establish another medical school in Israel. And now we are coming back to the very same point that we were 30 years ago. Meaning that we immediately need to establish more and more medical schools, while there was like a public understanding that whatever happens, we will have a lot of people in line. Enough engineers, enough doctors, enough writers, enough journalists, because of the big aliyah, which has not happened at the moment. Speaking about the current situation, we are on ongoing process of elections, one of another. And these elections brought us to the very critical point, meaning quite a substantial split about their different parts of the Israeli society. The question is, we are again coming back to the same story. Have a look at the opinion polls. And we see that the Israeli public is actually split about the one and the same issue, whether Israelis, average Israeli, believe that the government does right things. I believe that, in general, the answer is affirmative. However, we would know whether the severe steps that were done at the moment, we will see them, doctor will correct me if I'm wrong, we will see them in about a fortnight, in 2 weeks from now. However, it is very much important for Israeli government to explain to the public that it's what we necessary to do. We are doing what is necessary to do in order to avoid Italian scenario and maybe go along South Korean scenario and some other things. And we, just to finish this story, if you will permit me to say what is going on in the former Soviet Union, the former Soviet states, they're divided in two camps. One say, okay, it's overwhelmed and exaggerated, and not necessary to do what Israelis do, and some other people, and South Korean. But if you will have a look at the countries which have an open border with Iran, which is one of the centers of the problem, at the moment, they're very carefully following what is going here in the Middle East, especially in Israel.
Indeed. Mr. Oren, I'd like to hear your take on the current ability of Israel to function, considering the fact that even though, let's speak about the Iranians for a moment, they're continuing to try and thwart the contagion from spreading, even though they're miserably failing, unfortunately, in this endeavor. They continue at the same time to also advance their interests in the region, whether it is in Iraq and Syria and elsewhere. Sophisticated weaponry is trying to make its way into the hands of Shiite militias. There's still Quds Force officers of the Revolutionary Guard operating as advisors in different arenas, and it doesn't limit their efforts from doing so, all the while, of course, urging the international community very politely to urge the Americans to alleviate the sanctions regime imposed against them for their own malign activities in this region. To what degree is Israel able to continue at the same time, while dealing with this domestic challenge, to thwart the even evil endeavors, quote unquote, of its enemies in the region?
Well, the centralized mechanism of the nation state probably goes back to the age of Napoleon and the Code Napoleon, and you have a central government which controls and rules over the districts, the provinces, and all orders and edicts flow from the capital. And Israel, in a way and in a different style, because it is a parliamentary democracy, has copied this framework, which has a positive and a negative side. The positive side is that the Ministry of Health regulates all the hospitals and the community clinics which take care of people. And it can distribute quite rationally the various resources. Now, there are not enough resources, as Fadi mentioned, and there are many reports by the Comptroller General pointing out that in ICU, in intensive care unit beds, there is a 40% shortage, and not enough doctors to take care of patients who will take these beds, and many other, and laboratories too. This has been pointed out earlier. But this is really the positive side. You can regulate. The negative side is that it is overregulated. And so when a crisis emerges, the government is not fast enough in deregulating, in saying, okay, it is not going to be perfect, but let us test, let us move the process forward. Now, regarding security, I happen to have visited a fighter squadron, an F-16 squadron, in a northern base of the Israeli Air Force, just on the week when the crisis started. They have already managed to say to one shift of pilots and maintenance personnel and other officers, you come in from midnight to 12 noon, and you go home without seeing or touching the next shift. We are going to isolate our two halves so that if one of you falls ill and we have to quarantine you, the other one can still operate. And this is what they are doing, even including what you referred to, strikes in Syria against Iranian weapons flowing to Lebanon. One other point.
Shortly.
The Israeli Defense Forces has been empowered some 15, 20 years ago to help the police in domestic situations under emergency ordinances going back to the British mandate to 1945. Actually, it's like a civil arrest power. A soldier can accompany a policeman and help him get a riot under control, and they have been trained for it.
Well, we're drawing near to the end of the program, and I will want to follow up on this specific program in our next program, which will air on Tuesday on TV7. I'd like to get your take, each and every one of you, on how do you see the situation on the coronavirus management issue, specifically moving forward. Dr. Lerman, will start with you.
If, as it seems, Israel shows good signs of solidarity and cohesion under this stress test, as they call it in economic terms, then two benefits may flow, which the government is aware of. First of all, our enemies will again realize that Hassan Nasrallah was dead wrong with his spider web imagery. This is a society that is strong, resilient, and able to go through a major crisis. And moreover, given that Israel is innovative on the full range of things that may be relevant, from biotechnology to remote learning, we may actually find ourselves positioned, once this crisis is over, to advertise ourselves as a good destination for investment.
Professor Khanin?
I do agree that at the time of challenge, there is a challenge, but also there is an opportunity, including to remote learning that we are going to use to all of us at the moment. I think that it's also a possibility to revitalize probably internal industry, which move to eastward from here, and not just to rely on the high tech, which is also very important.
Dr. Essmaeel?
Actually, Colonel Lerman, I agree with Hassan Nasrallah. We are made out of spider webs,
which are very strong material.
The strongest material on the planet. So shout to our friend Sayyid Hassan, and also a shout to my colleagues on the front lines. I'm very proud of them, I have to say. I'm very proud also of my community where I live. They're really working, they're really doing what they have to do. Everybody's staying home. They're very sensitive to each other, always calling and helping each other, asking if somebody needs help at home, especially the older population. We also need to give ourselves sometimes credit where credit is due.
We'll talk more about the community also, where you live, and the community throughout Israel, as well as Israel's security challenges. Mr. Oren will give you more time next time around. But this is all the time that we have for today. I'd like to thank Dr. Lerman, Mr. Oren, Professor Khanin, and Dr. Essmaeel for being with us here today. And I'd like to thank our viewers as well, and join us for our next program as well, where we'll follow up on this specific topic. Shalom.
You just watched TV7 Jerusalem Studio. We encourage you to pray for the challenges raised in today's program. If you were blessed by our production, please consider supporting TV7 Israel. The details of our respective bank accounts for donations from Europe and the United States appear on the screen. Your generosity allows us to continue to serve God's calling, to broadcast content that truly matters through TV7 Israel from Jerusalem.